Hi there, so we're going to be doing the full body foam roller session. Just to go through a few of the points we covered. So any muscle group, and I mean in the group, so let's say we say hamstring, the whole of that muscle group. Never spend longer than 3 minutes on each muscle group. I would suggest sort of 8 to 10 maximum rolling up and down again on any muscle group, so calves or back. If you're going to trigger point, which obviously we'll talk through today, 30 seconds to trigger point it. If you feel like you would like to do a little bit more, do something else and then always come back to it. And again, about 30 seconds trigger pointing. Otherwise, you end up just bruising yourselves and sometimes making it a little bit sore. Okay, I'm going to obviously give you a couple of I'm going to do the sessions a couple of times with each muscle group, but obviously you might want to do a little bit more, so you can always just stop or pause it. You want to continue with one and then just carry on. Okay, so we're going to start off lying on the roller, so lengthways, so obviously just sitting on the end, coming back to lying on the roller. The other thing I meant to mention was hair. Just if you've got longish hair, just tuck it up because obviously it can get caught under the roller and that's not very comfortable to have your hair pulled. So tailbone on the roller, back of the head, feeling the roller run down the center of the back of the head, all the way down the center of the spine. And as I said, have the tailbone sitting nicely on the roller. So just finding neutral spine position, and this is really nice mobility for the spine. We're going to, on the in-breath, we're going to roll that pelvis forward. As we roll the pelvis forward, we feel the lumbar spine lifting up away from the mat. On the out-breath, we're going to roll the pelvis back, slightly lifting that pelvis up off the mat, off the roller, and feeling the flattening through the lumbar spine. We're going to do a couple more. In-breath, rolling the pelvis forward, arching through the back. Out-breath, flattening through the lumbar spine, and rolling up that pelvis. So you want to be finding about halfway point between the two. When you place your hands under your back, they shouldn't be able to meet in the middle. So you should just be able to take the hands between the roller and the back, but without actually meeting. So we're just going to stretch out through our pec muscles here. Office work, lots of driving, sitting at computers. We tend to get quite hunched and really tight through these pecs. So we're working on broadening those out. So we're going to float the right and left arm up towards the ceiling. On the in-breath, we're going to take the back of the hands down to the floor at shoulder height. And we're just going to leave the arms there. I want you to think about what your rib cage is doing. The minute we sort of open the arms, the rib cage wants to pop out. So I want you to make sure we're keeping that flat into the roller. Think about dropping the shoulder blades over the edges of the roller, trying to get them down towards the floor. And we're just going to stay here and breathe through this for about 3 breaths. Deep breath in and out. And on each out breath, I want you to think about relaxing those shoulders. Good. So after your 3 breaths, we're going to float those arms back up to the ceiling again. We're going to do one more time, floating those arms open, drop those shoulders down, never forcing the arms down. You want to feel like you're relaxing and relaxing those arms down onto the floor. And then on the out breath, we'll float back up to the ceiling again. So palms facing away from you. We're going to take right arm up above the head, left hand down towards the floor. Again, don't force the hand onto the floor. If it feels too much for you, I'm just going to do the other side so you can see. If it feels too much for you to have the arm reaching back like this, just place the hand onto the elbow, onto the shoulder, and just take the elbow back. Okay, so it just takes a bit of the pressure out of the shoulder joint than having long arms. Then we're going to drag the hands along the floor, bringing the arms out to the side. We end up with the left arm up above the head, right arm down, and back up to the ceiling. Again, we're just opening up through the pecs and mobilizing that shoulder joint. Left arm up, right arm down, dragging the hands along the floor, ending up with the right arm up above the head, left arm down, and back up to the ceiling again. Thinking again about this rib cage, deep breath in. As you breathe out, we're going to drop the elbows down to the floor at shoulder height. Again, don't force it to the floor. You might find you only get to there. If that's the point, we're going to take the back of the hands to the floor. Again, think about that rib cage staying down. Now, if you can't get your hands onto the floor, keep repeating that movement. So come back up and up to the ceiling, all right? If your hands aren't reaching the floor, just leave it there and then do this movement. If your hands are reaching, or the elbows to the floor, and then the back of the hands can reach to the floor, we're going to slide the hands along the floor, keeping 10 to 2, don't close to 12 o'clock. As you slide the hands up, you want to draw the shoulders down the back and think about that rib cage, that it's not popping up, and draw the arms back up to the ceiling. Good. So one more time. On the out breath, drop the elbows down to the floor. Take the back of the hands down to the floor. Keep the rib cage down. Float the arms up, slide the arms up above the head, drawing the shoulders down the back, and then floating those arms back up to the ceiling again. So we're going to interlock those fingers now so that our hands are like a steeple up in the ceiling. We're going to start to work the roller between the spine and coming in underneath this left shoulder blade. So by doing that, you're going to turn to the left. As you turn, you're going to roll that roller underneath that left shoulder blade. Take your feet nice and wide, that'll keep you quite stable on the roller, and we're just going to roll that back to the spine, and then on the out breath, rolling it underneath that shoulder. Okay, so I'm just going to talk you through some various arm positions to have. So you might find this one with the steeple works really well for you. If not, you could try crossing one right hand over your chest, open your left hand out, exactly the same movement. You're rolling onto your left side, rolling the roller underneath this shoulder, good. And back to the center again. And the other position you can try is crossing both arms over your chest and the same thing. So rolling it under. So depending which one you feel, and you might want to try all three and change the position each time. Some lift the shoulder blade up a little bit away from the back so you can get underneath that scapula. When you find a tight point, we're just going to stay on it and just rocking from side to side, trigger pointing underneath there. You can come all the way over. We are going to come a little bit more into the rotator cuff with another exercise. So you're really just using this one to get underneath that scapula, underneath the shoulder blade. Good. Obviously your head is turning to the left with the body. And again, when you find a tender point, just staying on it a little bit and trigger pointing it. Brilliant. So obviously the same, the other side. Again, choosing the arm position you want. Rollering to the right. The arms drop, the head turns to the right and back to the center. And I would always suggest doing a couple of rolls. Even if you find a tender spot, just do a couple of rolls. And then once you then have done a couple, then you can find a slightly more tender spot and you can work in a little bit. So remember, the muscles don't like you to go in hard straight away. So that's why I suggest just doing some nice gentle rolls a couple of times first, just almost warming those muscles that you're coming into them. And then they tend to relax and allow that roller to get into the tight spot. So we're going to slide the head back now so that the base of the skull, where the neck meets the skull, the occipital area, we're going to place the edge of the foam roller onto that occipital area. Now again, have a little play with it. You can change position, so you can take the head a little bit further up if you're not feeling much, or obviously just come down slightly. Again, we're just going to turn the head a couple of times from left to right. Feel the edge of that roller running along that base of the skull. You can gently put a little bit of pressure back through that head. If you start to feel your neck is uncomfortable because the head is hanging off the roller, you can just place the hands underneath the head. I suggest you draw your elbows together and just take a little bit of pressure into cradling those hands. The hands are cradling the head, just to take a little bit of pressure off that roller and support that neck a little bit. Good. So once you've done a couple of warm up on each side, just preparing those muscles, saying I'm coming in there a little bit. When you find a tight spot, we're going to stay on it. And then you're going to imagine you're very gently shaking that head. No. And then very gentle nodding. Yes. Good. And like I say, don't stay on any point longer than about 30 seconds. You can always move away, move on to another spot. Same thing. No. And yes. And then come back to it again if you want to come back to that point. So I'm going to leave that with you. Take your time. Like I say, no longer than about 3 minutes. But this occipital area can cause a lot of headaches. So if you're suffering with headaches, have a go at releasing that occipital area in your in the base of the skull. Excellent. So we're going to slide off the roller, place it behind you. Now, I think we've talked about this before. Never sort of lift up when the roller is below the rib cage. So you always want to start at the base of the rib cage. The rib cage obviously then is protecting all those internal organs. You don't want to be lifting up and putting all your weight through that kidney area. Okay, so placing the roller, bottom of the rib cage, support the hands with the head. So again, you're just cradling the head, chin towards the chest slightly. You're going to lift the hips up, and then you're gently going to roll back and forward on the roller. So you want to be going from the bottom of the rib cage all the way up to the shoulders, but never onto the back of the neck. So just top of the shoulders, and then you're rolling back down again. Good. So as you start to roll the roller forward, you can drop the head a little bit. Don't drop it at the moment below the spine. If that's feeling too much for you, obviously you can take the weight off by lifting the head a little bit more. So if it feels like it's too much pressure when you drop your head down level with your spine, then just keep the chin to the chest and rolling back and forward. Good. And obviously by lifting those hips up a bit higher as well, you're taking a little bit of weight off that back. Good. So once again, you sort of had a couple of goes, you might feel some gentle popping up through the spine. That's fine. We're going to come sort of between the shoulder blades, maybe the bottom of the shoulder blades to start. And we're going to roll onto our left side. Good. So we're going to come onto the left side. You can place the knees on top of each other. And we're just going to find an area, medial scapula, so the inside of that shoulder blade. And once you've had a bit of a roll up and down, oh, there's quite a good spot. Again, we're just going to turn in and out. So we're just trigger pointing. Again, you can still stay lifted up if you want to. If you want to put a little bit more pressure through there. Again, we're just finding the areas on the inside of that scapula, shoulder blade, and we just trigger. So either by turning the body in towards the roller and out, or by gently rocking back and forth. These are all what we call trigger pointing into those tight areas. Okay, so again, no more than 30 seconds on each spot. Again, we're going to go to the right, finding a tender spot. We're just going to roll up, imagining that roller on the inside of that shoulder blade. And again, when you find a tight spot, you're going to roll towards the roller and open back out. Good. And then you can stay on it and just gently rocking back and forth. Excellent. And then, so again, I'm going to leave you with that. The next thing we're going to do is, again, having that roller between the shoulder blades, finding an area down that spine that maybe feels a little bit tight, a little bit stuck. Deep breath in. As we breathe out, we're going to drop the head down below the roller. Now I want you to do this very gently. Try not to let that rib cage pop up. Think about that pelvic curl, so you're slightly flat through the lumbar spine and cradling the head, and then we're going to bring those elbows together. Good. And then coming back up, so the back of the head is level with the spine. Good. On the out breath, just dropping the head down. Now, if this feels too much for you, then obviously you can reduce the amount you drop your head and back up. And then I'm going to change the position, maybe bringing it up a little bit higher. On the out breath, drop the head back, elbows come together, and then lifting it back up again. Brilliant. And that way we're just opening up through that thoracic back and releasing it. Okay, so now we're going to turn onto our side. We're going to place the roller underneath your armpit. So we're working here a little bit on the lats and also on the sort of insertion of that rotator cuff area. Now this area, when it's tight, can cause a lot of kind of head of bicep, top of shoulder discomfort, even sort of pecs, that sort of thing. So place the roller underneath the armpit. You can either just leave the hand down, or if you need to, you can just support your head. Place the other hand behind the head, and we're going to roll the chest to the towards the roller, and then we're rolling back and opening the chest to the ceiling. Now, you're going to feel, if it's tight there, you'll feel like you're slightly just bouncing over some muscle there. It might feel quite tender. Obviously, just lift up a little bit more if it feels too tender. Just warm it up gradually. Once you've had a couple of goes, when you find a tight spot, we're going to stay on there. We're going to rock up and down, or just gently going to rock from the left to the right. Again, just trigger pointing that muscle. Good. Now, the other thing, just to reiterate, is slowness is what we need to be focusing on. If you do it too quickly, you're just running over the muscle and you're not actually allowing the roller to get into that muscle. So very slow movement. Okay, so we can move that roller down a fraction more, and then we're going to work this exactly the same, opening the chest to the ceiling and closing the chest down towards the roller. Brilliant. Just a couple of times, feeling any tightness, and then once you've had it 2 or 3, probably 3 gentle rolls back and forth, you can then trigger point. So again, just gentle opening and closing, and just rolling up and down to trigger it into that area. It's a tender area, so I would go quite gently with it. And again, you can roll it down a fraction more. So if you imagine your shoulder blade, we're going to work from the armpit, middle, and then at the bottom of that shoulder blade. And exactly the same thing, just rolling forward and back. Good. And then when you find a spot, we're going to stay there and just rock forward and back. Keep working with breath. because that relaxes the muscle. The more the muscle is relaxed, the more the roller can get in and release that tightness. And again, just rolling up and down. Excellent. So you're going to do that both sides. But obviously I'm just going to show you that one, but it's exactly the same on the other side. And we're going to come now to sitting. In fact, sorry, no, we'll just do it underneath the glutes first. So we're going to come down to lying, tuck the tailbone up, and you're going to place that roller underneath your glutes. Okay, so the legs are up into tabletop position. You're going to need to keep hold of the roller, but I would hold it right at the edges, because we're going to be rolling the knees and otherwise the hands get in the way. Okay, so legs up into tabletop position. Think about that lower back. So you don't want to be doing this, pushing that rib cage up. Make sure you just tilt that pelvis, drop that lower back down. It's not going to come onto the mat, but you want to feel like it's coming towards the mat. Okay, so legs into tabletop, and we're just gently going to roll from one side, coming onto the right side of the glutes, and center, again, keeping that core engaged, belly button drawn to the spine, so you're not pulling on the lower back, and then over onto the other side. Again, you're going to do 2 or 3 to each side, and then if you find a nice tender area there, you can just stay on it. You can just rock from side to side. You can lengthen and bend that lower leg just to help to trigger it a little bit in there. And then again, the same on the other side. And again, once you've had a little go with each side, just finding a tender spot, working into it a little bit. Then we're going to cross the right knee over the left, roll onto the right side. So you're using that top leg to sort of weight down that right glute. And again, finding a tender spot and just working. You can do little circles with those knees and just working it into that tight piriformis muscle. I'm going to show you on this side. So the top leg is placing pressure on the bottom leg and just adds a bit more weight into that glute, so you can really just rock from side to side and get it into that piriformis. But play with the whole area, so between sort of the sacrum and out towards the hip joint, and all from the top of the glute medius down to the bottom. Make sure you're working through all those glute muscles. Good. So the psoas stretch now, hip flexor psoas stretch. Again, if we're doing lots of sitting at desks, this muscle can get very tight. The psoas muscle attaches into the lumbar spine, so it can cause a lot of backache as well. So a good muscle to stretch out. I'm going to take hold of that right knee, draw it towards your chest. If you have knee issues, then place the hand behind the hamstring. Flexion through the left foot. Again, watch that back. Don't let it pop up. Keep the back down. And we're going to take that left foot towards the floor. If you find by putting it on the floor, you can't keep that back down, don't worry. Just keep it long. The more you pull on that right leg, the more you're going to get that stretch through the hip flexor. Good. Again, hold for about 30 seconds, and then you're going to take the right leg up to the ceiling. Take hold of the calf or hamstring. Try and keep the shoulders relaxed, and we're going to give a nice hamstring stretch here. Good, and again, holding for about 30 seconds. So the same on the other side. Lengthen the right leg away, foot in flexion. Hug that knee in towards your chest. Trying to get the foot towards the floor, but not losing that neutral spine position. Holding for about 30 seconds, and then up into the hamstring stretch. And breathing through that for another 30 seconds. And then just hug those knees in, and we're going to slide that roller out. And we're going to come up to a sitting position. Probably best to roll on your sides, don't pull on your back. And we're going to come to sitting on the roller now. Good. Okay. So if we're going to work through lower back, again, we don't want to place too much pressure onto this sort of lumbar spine here. You can take the hands behind you and very gently sort of roll up and down. But most of lower back pain comes sort of from these hip flexors or tight glutes. So there's really no need to put too much pressure up through that lumbar spine. Okay, but you can certainly release and have a good, nice roll from the glutes all the way into that lumbar spine. So we're going to start to go back onto these glutes again. So we're going to turn onto that left side. So the right side is actually lifted up, and I'll just show you on the other way. So we want to have that lifted up off, and so we're going to work on the glutes that's down into the roller. Good. So we're just going to roll forward and back a bit. You can have the one leg crossed over the lower leg. Make sure the lower leg is long. Have a little roll back and forth. Then place the top leg behind and have a little roll back and forth. When you find a tight spot, again, just stay on it, rocking back and forth, turning in and out on the roller. Just trigger pointing that a little bit. And then to increase that more, we're going to then place the left ankle onto the right knee. That puts that piriformis muscle on the stretch. So we're going to really get into that now. And again, we're just rocking side to side. Staying on the left side, the right side is lifted, and rolling up and down. Good. And again, all the way up and down. And then when you find a tight spot, stay on it and just rocking up and down on the roller and forward and back. Excellent. Okay, so the same thing on the other side. Obviously start with the long leg, the leg behind, have a couple of rolls. Cross the leg over, because that also just changes the weight onto the roller. So you're just working different muscle groups there. And once you've had a go with that, you want to trigger point a little bit more, you're going to take that right ankle onto the left knee. Again, you're putting that piriformis on the stretch. Roll up and down until you find the tight spot. And then we're going to gently rock and turning into and away. Good. Again, 30 seconds on there. And then move on to something else and come back if need be. Okay. IT band attaches knee to the hip. When the IT band is tight, it can cause a lot of hip pain, or you can get a lot of knee pain, okay? A good muscle to work, but a very tender muscle, so take it easy with this one. You can do with a straight arm. That obviously takes a bit of weight off the roller, so if it's very tight and uncomfortable, then come on to the straight arm. If you can, we're going to come on to the forearms, and we're going to roll up and down. So depending how you feel, I tend to sort of work sort of from the knee, never over the knee joint, but from the knee sort of midway up, and focus on that for a little bit. And then obviously you can work up the second part of that leg. Good. Again, you can change that leg position, so you can go in front or behind. Oh, my IT bands are sore. So this is quite, just, you know, can be quite uncomfortable. If you need to though, use the supporting leg to take some weight. So that can help you to lift up slightly, take the weight off it if it's feeling too uncomfortable, and also the arm. And if you want, I mean, if you're not feeling much, you could double those legs up and work through, but it is a tight muscle. I can't imagine too many people are going to feel comfortable to do that. Okay, so you're going to do that, both sides, left and right. Again, 8 to 10 times up and down, and maybe a little bit of trigger pointing through that. Okay, so coming on to the calves now. We're going to place that roller underneath our Achilles. Just to say that when we're working the legs, it can take the wrist can take quite a lot of strain. So I'm going to just talk through some various options that we can do. One of them actually is to use a chair. I'll just show you quickly with this chair. And maybe this one might be a little bit high, but you can place the elbows onto the chair and you can lift up and roll up and down, and then move the roller up and again lift, and you're getting a good shoulder workout here. But the other options, I'm just going to move this chair back out of the way. The other option is to just use the other leg as a weight. So if we start through the Achilles, so we're just going to start slowly, rolling the feet from left to right. If that feels okay, then you can cross one leg over the other, and again, just very slowly rolling the feet from the left to the right. Of course, you can lift up if you're okay with the wrist, just placing a little bit more weight through there. And we're going to slowly, again, just portioning up that calf and just rolling. So the choice is yours. Double leg, roll up and down. If you want some more weight, you can roll up and down. If your wrists are uncomfortable, stay there and just rock from side to side. But do it slowly. If you just go like this, you're going to be bouncing over the muscle, nothing's going to happen. So you're placing weight into that right calf, and then you're just rolling it from the left to the right. Come up a fraction more. Never roll over the back of the knee, okay? So we're going to do calf, and then we'll lift it up, place it above the knee onto the hamstring, and then work up through the hamstring, okay? So again, I mean, I would spend at least 3 minutes on each leg here. The calves can get very tight, and it's a great way of releasing them. So obviously both legs, and just to say again, you can lift up and roll back and forth. But personally, I feel just as much pressure comes through there when I've got one leg on top of the other and I'm just slowly rolling from one side to the other. I can really feel it getting in to those calves muscles. Okay, so pretty similar with the hamstring. It's slightly easier to come onto your wrist with the hamstring because the roller's taking a little bit of the weight as well. So you can just roll up and down with the hamstring. If you want a little bit more pressure through, we're going to take the left over the right. That means we're working on the right hamstring, rolling back and forth, and then if you want even more pressure, you can place your foot on top of the thigh, not the knee, on top of the thigh, and rolling forward and back. And again, also just rolling from side to side. Good. Okay. Again, just take your time. Work slowly up the leg. If you're finding a tight spot, just stay on it and rock from side to forward and back, or very slowly from side to side. And you're going to work both legs like that. And that's calves and hamstrings done. So, quads, okay? Again, can cause a lot of knee pain. Our quadricep muscles actually cross over the knee. So if these quads are tight, they pull on the knee, and also obviously affects hip flexors as well. So really important to work these quads off. So the nicest one really is to take both legs over. Again, always avoiding knee joints. Straight arm, obviously, a little bit easier. You're not putting so much weight through there. Forearms, you're getting a little bit more weight. You're lifting those feet up off the mat, and you're rolling all the way up and down. Good. And come all the way up into the hip flexor there. That's a good point to work. Okay. So if you decide you want to put a little bit more pressure through there, and I'm trying to do this so you can see. So you place, if we're going to work this right leg, place the edge of the roller in front of that right leg. Above the knee comes over the roller. So I'm going to move it now so we can change the position. So you're placing that right leg over the roller. The left leg comes out to the side. You're on your forearms and we're rollering forward and back. Okay. Now, if that feels too much for you, obviously you can take more pressure through that supporting leg to take a little bit of weight off it. So I'm going to do it on this side. Again, 2 or 3 rolls up and down before you start to trigger point. But what you want to realize is the quadricep runs all the way from left to right, front of that leg. So make sure you vary the angle slightly. So turn on to the outside of the quadricep, run down through the center, and then also coming a little bit onto that inside. Brilliant. So rollering that forward and back. While we're talking about the inside, the adductors, medial thigh, you don't often get much, a release through there. So if you've got tight adductors, you're lying with the right leg is clear, you're popping the left leg over that roller. The foot stays on top of the roller, and you're going to roll in and out on that roller. So come down to lying a little bit, getting a little bit more weight down through there. Place the hand under the head, and we're just rollering in and out. If you want more weight on there, then stay up on the arms, and we're rolling through that inner thigh muscle. And try again, come into that hip flexor. So roll all the way up into that hip flexor and away again. Good. So same thing on the other side, sort of 8 or 10 times. You want to trigger point 30 seconds. And then move away and maybe come back to it. Okay, so front of the shins. Again, muscles that we don't even realize that are tight. So we're going to place our knees over the roller. Come onto all fours, so onto your wrist. We're lifting the feet up off the mat. You don't want to be on your knees, yeah? So it's just below the knees. We're going to pull the roller as if we're going to pull that roller in between our hands. And then we're rolling it back. Good. If that feels not too bad, I can take that's quite bearable. Take the weight down to your heels. That obviously increases the pressure through the shins onto the roller. Again, really nice muscle to stretch out. We do spend quite a lot of time on our feet. Splint shins if you're a runner. Very uncomfortable. When you find a tight spot, just roll from left to right. So you're working those tibialis muscles on the side of the shins there. You can come down over that ankle joint a little bit, the front of the ankle joint. Excellent. Okay, so I'm going to leave you with that one. We're going to finish off now with the neck. Okay, lovely to use the foam roller for your neck. And just before we go on to the neck, that's back to that occipital one we did with you lying on the roller. You can also use do this one with the roller coming in from behind. So same thing, getting that roller to the base of the skull, and again, just rolling the head from left to right. Okay, so just another option, and then the same thing, gentle nose, and yes, if you find a tight spot. So we're going to place our necks over the roller. Good. Again, change with the position. Very slowly, you're going to roll to the right and then to the left. If you're not feeling much, you can either open the head up slightly, pull the roller down a little bit more, or you can take the chin to the chest a bit more until you feel that that roller is coming into those muscles at the back of the neck. Again, slow movements though, and I'm sorry because I'm talking, I'm probably swinging right to left, but you want to make those movements very slow. And then if you find, oh, that's a nice tight spot, stay on it. You can gently place a bit of pressure through the back of the head. And again, we're just going to do gentle nose, just rocking the head from side to side. And yeses. And again, no more than 30 seconds. Make sure you come all the way so the ear touches down to the roller, then coming into slightly into those sort of scaling muscles that run down from the ear to the neck. Can be quite tight muscles. Again, play with the position of the roller. Good. Again, lovely to work the neck a little bit, loosen off through that neck. I think necks are something we probably all suffer with some tightness and tension, and again, can cause a lot of headaches. So that's pretty much your full body roller session. Like I say, I mean, I've obviously flipped through it a bit quicker, but you can just obviously pause. It's giving you ideas to get into positions and how to do it. And most importantly, enjoy it. All right. Bye-bye.